Okay, here we are with facial bones. We've got paired and unpaired bones in the face as well, and that's the thing that you need to know. For the exam, should have mentioned that with the cranial bones too, but you need to know which ones are paired and unpaired. This is something that we go through in the lab too. So you'll get it in multiple places. No worries. But let's go through some of these facial bones. We're going to start with, let's not go in order of what I have here. Let's start easy. Start easy and go more difficult. So down here at the bottom, we've got, uh, just going to get this laser pointer going here. There we go. Okay. Down here at the bottom, we've got mandible. That's easy enough. Remember, that's the only facial bone that actually moves. It has like a movable joint. So mandible down there. And then above that, we've got maxilla. So I think a lot of people probably come in already from the prereqs or just from just random knowledge around that you've gained. And you know mandible and maxilla. So mandible down here is your jaw. Maxilla is the top part of the teeth. The maxilla actually has a lot more to it than just the top of the teeth. And you can kind of see that here. It forms some of the cheekbones. It forms a lot of the nasal opening, like up the structure of the nose. Even up here at the bridge of the nose. Some of the orbital socket as well. You can see a little bit of that tan color inside the orbital socket there. So this is all maxilla. And then there's more that the maxilla does that we're going to see here. So the maxilla also goes into the mouth too. It's not just on the front. There's parts of it that go into the mouth. So the maxilla is a pretty important bone. This is like a heavy hitter of a bone. The mandible is important only because it's the only movable one. It's where the teeth are. So, it's got some importance that way. The maxilla actually does a lot of different things. So it's just kind of, it's doing everything. Okay, so let's move away from the maxilla and let's look over here on the side. We've got these blue ones, the cheekbones right here. Those are the zygomatic bones. The zygomatic bone is everything that's in this turquoise blue color. And sometimes this is called, this portion of the zygomatic bone is called the zygomatic arch. So the cheekbones right here, that's the zygomatic arch. But it does more than just form the zygomatic arch. It also does a lot of the orbital socket, the outside part of the orbital socket, and the inside where your eyes actually sit. And then, where do we want to go next? Let's finish up the outside of the face. Right up here, the two nasal bones. They just kind of form the bridge of your nose. Right here. Let's go back through this really quickly. There's two nasal bones. There's two zygomatic bones. There's two maxilla, or maxillae. This is the plural. This is the point where you have one right and one left. But there's only one mandible. That is not two bones. This is just one bone here. There's two maxilla, but only one mandible. Two of everything else that we've talked about. And now let's start moving inside. We're going to go to this harder to see stuff. First, we're going to look at the lacrimal bones here in green. So the lacrimal bones do two things. Number one, they form part of the orbital socket, which you can kind of see. This is where they are. And then number two, they also house the tear ducts. So there's a hole in the bone where the tear duct will sit and then allow tears to actually come out into the eyes. The excess drainage, this is why your nose gets all, like you start having all the snot when you start crying, especially the like the ugly cry, you know, and it's just like "Wah," like coming out everywhere, is because the excess that can't fit out of the little hole in the eye all dumps into the sinuses, essentially. And okay, so how I remember this is lacrimal bone, tear duct. Lacrimal sounds like lactating, and it's kind of like your eyes are lactating when you're crying. So, yeah, I mean, that makes 100% sense, right? Lacrimal bones. Great. Um, what else do we need to talk about? We've got inferior nasal concha right here. Inferior nasal conchae, there's two of them. Right here, this is just part of the sinuses, the sinus structure that helps warm and moisten air as you breathe. And then the last one that we haven't talked about is the vomer. Really quickly, inferior nasal concha. You've got that down there. There's one of the bones you need to know. Well, why is there not a superior nasal conchae group or middle? Well, I'll show you why. They're here on the ethmoid bone. Superior nasal concha or conchae, because there's two. And then middle are right here. So you've got all these. Middle, superior, and then there's no inferior on here because inferior is its own thing down here, inferior nasal conchae. Okay, then the last one is the vomer, which you can just barely see right here. It's this little purple bone, which means this white thing right here that they're not talking about is the perpendicular plate of the ethmoid bone right here. And this is the vomer. So we're looking at the entire septum right here. Let's go ahead a little bit and talk about the vomer. So here's the vomer. It's unpaired, just one vomer right in the middle. It's the lower half of the septum, the ethmoid, perpendicular plate of the ethmoid bone, the vomer, and the septal cartilage. Those all form your septum. If you put your fingers just like right inside your nose, what you're feeling is the septal cartilage. You have to go like way back in before you start finding ethmoid and vomer. Usually in my in-person classes, I say like, don't do that now because it's gross, but you're at home. And so if you want to explore your vomer, I guess that's, you can. I wouldn't, but you know, whatever. So in other animals, especially cats, like large cats, but small cats and large cats, house cats and tigers and lions and stuff like this. The vomer is where the vomeral nasal organ is located. It's a primary pheromone receptor in those animals. Could be humans, like if we are receptive to pheromones, this could be a place where some tissue is located that would connect to the terminal nerve. I'm skeptical if we actually are susceptible to pheromones. The science is kind of skeptical about it too, but that's not to say that there aren't studies that show that humans aren't susceptible to pheromones in a small way. But then there's also studies that show that we're not. So it's kind of a weird area. It's hard to say yes or no. There's not a lot of money in it either, because like we know that if humans are somewhat susceptible to pheromones, it's not going to be a ton. So then why do we care one way or the other? Anyway, let's move on and talk about stuff that actually is important. Yeah, this is a crazy slide. And the reason it's crazy is we've got some poorly named structures. Really poorly named structures that we have to learn about. There's one set of facial bones that we haven't talked about yet. and those are the palatine bones. The reason we haven't talked about them yet is because they're hidden inside of the mouth. They're kind of L-shaped little bones. They're called the palatine bones. They're paired. There's two of them. So here's the thing about the palatine bones. They form the palate. Part of the palate, not all of the palate. In fact, they form the posterior part of the palate. The palatine bones form the posterior part of the palate. But there's a particular part of the palatine bones that forms the posterior part of the palate, which is the horizontal plate. That's what I've got circled in green here. Horizontal plate, palatine bones, posterior part of the palate. Okay, so like, never mind. I was going to say something, and it's going to be invalidated by the very next thing that I say. So don't, it's cool. Let's just keep going. So this posterior part is the horizontal plate of the palatine bones. Cool. But that's the posterior part of the palate. There is also this whole anterior part of the palate, which is formed by the maxilla. Okay, so that's nothing's too terrible yet. Until I tell you that the part of the palate, the part of the maxilla that forms the palate, is the palatine process. Not the palatine bones, the palatine process. And here is where you can pull your freaking hair out. Because why would they name it like this? This is ridiculous. I don't know. If I could change it, I would do that for all of us. You, me, every other person that ever has to learn this in the world. Well, in the English-speaking world. I hope it's not so stupid in other languages, but, you know, it is based on Latin, so it probably is. So, maxilla, anterior, palatine process. How are we going to remember this? Okay, here's how we're going to remember it. We need to draw on the screen, which I can't do. That's okay. We're going to bring up notepad. I have something in my notepad. I didn't know that there was something on notepad. It was like a citation that I needed for a paper that I was writing. And now I'm curious if it's, see, this is it right here. Like, do I need this? I don't know. Okay. So what we're going to do is, we're going to have part of the palate. That's the first thing that we're going to have. Then we're going to have the bone. Then we're going to have the process, right? So this is how you're going to remember it. The part of the palate, the bone, and the individual process of the bone. So we're going kind of like bigger to smaller to smaller to smallest. Which part of the palate, what bone is it in, what process makes up that part specifically, okay? So we're going to have part of the palate is anterior. Then we've got one down here that's posterior. And the anterior portion is, you can play along with me while we do this. Anterior portion is the maxilla. And what's the process? Well, let's go down here. Posterior part, what's the bone? It's the palatine bones. And then now we're going to go to the process. For the anterior portion of the palate, it's the maxilla and it's the palatine process. For the posterior part of the palate, it's the palatine bones and it's the horizontal plate. Okay. Horizontal plate. So far this doesn't look very easy to remember, except that if you take the first letters of all these, you get amp. And then you also get PPHP, which is literally nothing. But amp is something. So what you need to remember for your exam, because this is going to be on it, like which part does what you need to remember is that it's like the part of the palate, the bone, the process. Bigger, smaller, smallest. And amp is the one that you can remember, right? So anterior maxilla palatine process. And everything else is everything else. The posterior portion is palatine horizontal plate. You could remember that as just a series of P's if you want to. Posterior palatine plate. Posterior palatine plate. Posterior palatine plate. And then you've got amp as the other one, anterior maxilla palatine, right? Just remember that palatine is in both of those. You remember that the second one is the bone. The third one is the plate. Right? Okay. Well, maybe that helps. There's also, in the maxilla, the alveolar process. And that's where the teeth go. Alveolar, I told you this during the respiration, but alveolus means sac. So the little alveoli in your lungs and the alveolar process where your teeth go, they have nothing in common with one another except that they both look like sacs. One is little air sacs and the other are tooth sacs, like where your teeth can go. That's the reason why they have a similar name, just because somebody was like, I don't know, looks like a sack. And then they just sacked it up. So that's why. Alveolar process, where your teeth go. Palatine process, makes up the anterior portion of the palate. And again, I'm sorry about those names. But I didn't do it. I'm way too young, right? This is like pre-Da Vinci that they came up with this stuff. So anyway, cleft palate. Let's talk about that really quickly. You know some of this if you were in 205 with me and presumably also with anyone else. In this major, they've also talked about cleft palate in 205. But since we're talking about the actual bones that make up the palate, let's talk about cleft palate really quickly. You can see right here, this is where the two halves of the, right here, we're at the palatine process of the maxilla, where those come together. And here, where the horizontal plate of the palatine bones come together. So let's talk about cleft palate. So what's going on here is the maxilla bones, which remember are paired. You have a left and right maxilla. You have a left and right palatine bone. Those don't fuse at the roof of the mouth for some reason. This goes along something called the median palatine suture, which runs right here. This is the median palatine suture. Goes through both the maxilla and the palatine bones. It's just where the left and right halves come together. So for some reason, the median palatine suture doesn't fully close. One of the theories, of course, is that the tongue gets in the way. There's some other theories. Regardless of what's actually happening, those bones don't fuse, and you end up with a cleft palate. You can also have lip involvement, which we're not going to talk a ton about, except that it happens along this suture right here, the incisive suture. And so this is, and you can see the incisive suture comes between your second and third tooth right here from the middle, between second and third tooth here from the middle. And that tends to be what you see. If someone has cleft lip, it happens right between second and third tooth. If they have bilateral cleft lip, then you've just got these front 4 teeth that are kind of off on their own, just kind of out in front of everything else and not attached to the rest of the teeth. So that's cleft lip and palate, just in brief, since we're talking about those bones and sutures. Okay, let's dive a little bit into the mandible. There's some stuff here that we need to know. So the mandible has a couple of places that we'll need to remember. Number one is the condylar process, or condylar process, right here. This is where it articulates. This is where the mandible articulates with the temporal bone. So temporal bone has a little facet for this condylar process, and that's where the jaw can open and close. In fact, you see that down here. This is the condyle. This is the mandibular fossa, which is, you can just think of it as it's facet, fossa, facet. And this is the temporal bone right here. So this is where they fit together. Let's move over briefly. No, I guess I've got it all on the same slide. I'm just going to tell you really quickly. This other thing right here, this other process, this is the coronoid process, and we'll come back to that in a second. Okay, so TMJ pain. If you have TMJ pain, you probably know what it stands for. It stands for temporomandibular joint pain. And this site right here, if you think about it, we've got the temporal bone. So this is temporo. This is the mandible, not the man. This is the mandible down here. So temporomandibular joint. That's the joint. And then pain is pain inside that joint. Okay, cool. If you have clicking, you don't have to have, your jaw can click and you don't have TMJ pain. You can also have TMJ pain and your jaw doesn't click. A lot of times they go together, but they don't have to. What's probably happening with your jaw if you experience clicking is, do you see this thing right here called the articular disc? This is like a special portion of the ligament that's made to like cushion where these two bones articulate against one another. What's happening is when your jaw clicks is that the articular disc is slipping out from between the two. And then when you close your jaw, it clicks because your mandible is essentially like jumping back on the articular disc. So you open up and it kind of squishes out, click, and then you close your jaw and it jumps back onto it, click. Over time, you may end up having pain because of this. Or some people will just develop kind of like a scar tissue thing on the rest of this ligament here, and their jaw just stops popping. Essentially, they grow sort of a new articular disc. It's not quite the same because it's just scar tissue, but it kind of functions in a similar fashion, and that's what stops the jaw clicking. So if you used to have a clicking jaw and you don't anymore, you probably have some scar tissue on that ligament. If your jaw doesn't click at all, your articular disc is doing the job. If you have jaw clicking and some pain, this is probably why. It can be annoying. It can have pain. You can also, in very severe cases, end up with limited movement, which is called non-tetanus induced lockjaw. When that happens, you can get some, I think it's like antihistamines that are injected in that'll help it. And there's other reasons. Usually this comes from something like maybe the jaw is twisted in some way. There may be some orthodontic appliances that you might have to use. This is like in the realm for orthodontists. But that's what's going on with this joint. Okay, let's continue on to the rest of the jaw. There's the coronoid process. It's basically just a place for muscles to insert. We'll talk more about it when we talk about those muscles. And then down here, this is the mandibular angle, or the angle of the mandible. This is another place where muscles will insert. Okay, let's talk about your teeth. Teeth are sort of like bones, so that's why they're in this part. Um, if you thought we were done with anatomical directions when we were talking about the shark man, I'm sorry to tell you that we're not. Because for some reason in your mouth, when we're talking about the teeth, things are slightly different in a vaguely annoying way. So they're slightly different because the teeth are rounded. And that's not super annoying because that makes sense. The teeth have an arc to them. We're going to have a couple different names because, okay, that's fine. So let's talk about those first. So coming from the center, right between your two front teeth, right here, as you move away towards the molars, that's distal. Okay, that's fine. That's kind of what we know as distal, like further away from the middle. So that makes sense as a distal motion. As you go from middle to molars, that's distal. But then, as you're moving towards the middle, that's mesial. What? What? I'm sorry. Mesial? Why not medial? Mesial. It's ridiculous. So that's where it gets a little annoying. Why are we calling it mesial? It's medial, not mesial. Anyway. Should be medial. But apparently it's also mesial. So we're moving from molars to the midline. Medial, mesial. If you want to call it medial, be my guest. And then we've got some other surfaces that are going to make a lot of sense here. Number one, lingual. The lingual surface of these is when you're pointing towards the tongue. Lingual means tongue. We're going to see that a lot with our muscles that we're going to talk about in the same section. And so glosso also means tongue. You'll see in the muscles as well. And so each of these, regardless of where they are in the arc, if this side of the tooth is pointing towards the tongue, that's the lingual surface. Then we've got the labial surface, which is out here pointing towards the lips, and the buccal surface over here pointing towards the cheeks. So you've got teeth with a buccal surface, teeth with a labial surface, and then all the teeth have a lingual surface. Okay, there's your teeth. They come out of the alveolar process. We already talked about this. Means sac, not related to the lungs. And then here's some types of occlusions that you might see. In addition to just having like dental concerns, but we're not dentists. We're looking at articulatory issues, but that's why we're talking about it, because different bites, different occlusions can have different articulatory problems. So your typical bite right here is just a very slight overbite, just barely. That's typical. This is a far overbite here. This is an underbite. Those can both lead to issues with things like TH, F, anything that's involving placement of the teeth and the lips or the tongue. And then overly crowded will also lead to some issues as well with the same phonemes. Phonemes, dentals, basically. All right. And that's the end of bones. We're going to move on to muscles next. Everybody loves muscles. It's the best part. Okay. So here it comes.